Hello, I'm Dr. Gráinne Gorman and I'm one of the doctors here at the Wellcome Trust Centre for Mitochondrial Research, Newcastle University.
I'm Jane Stewart. I'm a consultant in reproductive medicine based at the Newcastle Fertility Centre.
If you're a woman with mitochondrial disease and contemplating starting a family, I'm here to guide you through the options open to you.
We know that this can be an anxious time for people considering having a family because of the risk of passing on a mitochondrial disorder to children.
It's important to realise that the risk of passing on a mitochondrial disease varies from patient to patient. There are options available that can either reduce or even eliminate that risk of passing on mitochondrial disease to your children.
If you're considering having a family, then the first thing you should do is to ask for specialist help.
Based on our assessment, there are several options open to you, including adoption. If this is something that you're not considering, then there are other options available.
One option, of course, is to get pregnant naturally. It's then possible to test the pregnancy, the baby, for mitochondrial disease. There are a number of ways to do this, but in all of them, cells are taken from the pregnancy and tested in a lab for mitochondrial DNA abnormalities. The procedures don't carry a great amount of risk for mother and baby, although there is a small risk of miscarriage following the procedures. You may not, however, want to consider undergoing that process with the risks it carries unless you would consider terminating an affected pregnancy. One option is egg donation. In this process, an egg is taken from an unrelated female, fertilised usually with your partner's sperm, and the resulting embryo transferred into your uterus, your womb. This means that the baby won't have any mitochondria from you, only from the donor. Your baby will be legally, ethically, emotionally yours, the only difference really being the difference in the genetics between yourself and the donor. PreImplantation diagnosis is a technique which involves the couple going through an IVF cycle. Before the embryo is transferred into the womb, cells are removed and tested for mitochondrial DNA mutations. What that allows is that we can transfer embryos that are least likely to be affected, significantly reducing the risk of passing on the disorder.
For us and patients, one of the most exciting areas of research at the moment is to actually prevent transmission of mitochondrial diseases. We can do this by taking the egg of a woman with mitochondrial disease, removing the nuclear DNA, which is what decides a child's physical characteristics, and implanting it into another woman's egg, which has had its nuclear DNA removed. So all the nuclear genetic DNA would belong to the woman whose child it is, but it would contain the healthy mitochondrial DNA of the woman who donated her egg.
Not only would this remove the risk of transmitting the disorder to a child, but it may also prevent the transmission to future generations. If you'd like to consider any of the methods that we've just described, please ask your GP or your mitochondrial specialist for a referral. We would see you alongside the mitochondrial specialist to consider your situation and to be able to provide the best advice for the options available to you.